Hello, everyone. 11 a.m. Eastern time here on our Instagram live. And it just popped up a notification that Brooke Shields just started going live as well. So if there's anybody that is going to be watching, I hope you choose me. And so, hey, you guys, you're all starting to come in. And today we're so excited to have Dr. Darria Long. If you've tuned into On the Story before, you know she's a great friend of the show because she is just a wealth of information. She's an emergency room doctor. She is the author of Mom Hacks. She's also a working mom herself who deals with all of the things that so many of us do. So she just comes on the show so often and gives us all the nitty gritty when it comes to life, medicine, health, anything that really we throw at her. So we thought in this time of COVID, she would be the perfect guest. So we are just waiting for her to click on to invite her in. And while we are waiting for her, I do have a couple of questions. If any of you are Instagram Live savvy, I can't quite figure out why my videos have those black panels on the side. I'm filming it in portrait because that's what they told me to do. But am I supposed to be filming it in landscape? Does anybody know? And if you, hi Carrie, she just waved. I'm gonna wave back at you. If you know, I would love some insight into this because everybody is noticing that I clearly have some issues when it comes to Instagram Live technology. So we are waiting for Dr. Darria. But something that I want to ask all of you while we wait for her is if you have any questions when it comes to COVID. So one of the things that I've heard most from people is whether or not they should get tested for COVID, even if they don't have the symptoms. Testing hopefully is more available, and is it worth going to get tested even if you don't show the symptoms? And that's something that we are going to check with. There she is. Here we go. All right. So, Dr. Darria is here in 3, 2, and 1.
Hi! We did it!
I swear every single time I do one of these, I have some sort of technical difficulty.
I know.
I don't know. I'm only 40 years old. I don't know why I act like I'm like the 80-year-old that can't figure out Instagram Live.
I know.
Oh,
It's like, where's this button?
Exactly.
Great.
It's so good to see you. Normally I'm seeing you there on set. I wish I could give you a hug, but virtual
right?
hug to you.
Virtual.
You've been doing some incredible work. I've seen
You.
on Instagram and on CNN and HLN, just helping to answer some of the questions for people. And I was just curious first, what's the most frequent question that you've been getting about this?
Oh, that's a tough one, Lynn. I think some of the most common questions are, should I be worried? And then, which is a big existential question. And then they come down to the practical, like, so what should I actually do? Should I be wearing a mask? How do I handle my groceries? What do I do with my mail? So they go in all the extremes.
And what about the should I be worried? Because actually we had one person on my stories, it was N.A. Frazee, who said, listen, this isn't something you should be worried about. Just use common sense and you'll be fine. Is that the case? Because obviously, I mean, I've known people who say, I've done everything, the social distancing, I've stayed at home, and they still got it.
So what I am telling people is that in the world of, if there's like apathy over here and there's panic over here, I need you in the middle. I need you aware of this. I need you cautious, and I need you vigilant. And if we can do the things to stay vigilant, then we don't have to be erring on the side of panic and this being keeping us up at night because we know we're taking the smart steps.
What about another question that came in from SDD31? She said she doesn't have any symptoms, but she's wondering if she should get tested. And actually, before you came on, there were a couple of other people who have been asking me this question. So I was curious, you know, if the testing is available, should you just go regardless, just to find out?
I'm telling most people, wait a little bit longer. There have been some issues. The FDA lowered the regulations for testing because they wanted to get more testing available. We're talking about the serology here to see if you have antibodies, to see if you've been exposed to it, not if you're acutely ill. So they tried to lower the regulations for that. And so as a result, they just flooded the market with all these tests for serology. A lot of them, we have no idea what the accuracy of them is. So what I'm telling most people is now the FDA is starting to catch up. And earlier this week, they said that all of those companies that flooded the market with testing had 10 days to send the FDA their data. And if they didn't, the FDA was going to pull back their authorization. So I'm telling most people, unless you actually need it for work or somebody's telling you you have to go get tested and you know it's a verified source, wait on the antibody testing, wait for a couple of weeks. I think the dust will settle and then we'll know which tests are reliable. We can go do that. That way you're not getting either false reassurance or false concern. Because we don't want that.
And that's one thing that Stuart here in comments just chimed in on and said, isn't testing really just a snapshot in time? Is that going to give us any kind of accuracy that we need for the long term? So you may test negative and then 4 hours later you could test positive, but you're not going to go back to CVS drive-through and get tested again.
Right, you give 4 hours later you could get exposed. Yeah, so there's two different types of tests for Stuart, and what Stuart is probably talking about is the acute illness that you are sick right now with acute infection. That's going to be a picture in time. And yes, just like strep throat, I could swab your throat for strep right now, Lynn, and then you could go out and get strep throat from your 4-year-old 6 hours later. So yeah, any test is a snapshot in time when it comes to the acute illness. The antibody test is different though. That's going to be telling us, have you been exposed to it? Have you mounted an immune response to it? Have you, potentially, do you have some immunity to it? So two different tests, really important to differentiate the two.
Let's talk about testing of the virus. We recently heard the president say, if you want to get tested, you can get tested. Is that true? Fact or fiction?
That's kind of fiction. That's fiction-ish, Lynn. I know we talk about fact and fiction a lot. So they've been saying for months that if you want to get tested, you can get tested. And the truth is it's a lot harder to actually go out and get tested right now for it. It's getting better. In my own ER and a bunch of different places, we're getting a lot more tests. It's definitely getting more possible. And I think it will just get easier every week, but we're still not where we need to be.
I actually talked to you yesterday on the phone just to check in about today and everything, and you were in the ER. What has it been like in there? What have you been seeing just firsthand?
We're seeing more people with respiratory symptoms, of course, concerned that they have COVID or some other respiratory problem. But so we're seeing an increase there, and really sick patients that can go from being well to suddenly sick very quickly. So that is a challenge. On the flip side, Lynn, it's really interesting. We've been seeing big declines in everything else, which is really concerning for me as a physician, because the normal heart attacks that are coming in and appendicitis and all these different, things like that aren't coming in. And a heart attack doesn't really care if there's a COVID epidemic or not. Heart attack's probably more likely during all the lockdown and COVID. So that really worries me that people are delaying care. So if people don't think they have COVID and they're afraid of COVID, they're not coming in. And Lynn, I actually had one patient say that she said, I knew I had a problem, but I didn't want to come in and take away a bed from a patient with COVID who might need it. And I hadn't even thought of that, Lynn. And so message for everybody is, if there was something that would have brought you into the ER before COVID, come in anyways. We're all taking steps to make sure that you're not getting exposed in the emergency department to COVID. If you need emergency care, if you need any kind of care, go get it. Please don't delay.
I'm so glad that you brought that up, because something that we have been hearing a lot about is a possible second wave of a health crisis after COVID. When you think about all the elective surgeries, when you think about the chemotherapy, the heart surgeries, all of the different treatments that people have avoided, how big of a deal do you think that will be? And is there anything that the government should start doing to mitigate what could become the second wave?
So I think that's a big deal. I think those are two separate issues. The delayed care, we have got to get that restarted. You mentioned the elective surgeries, cancer chemotherapy, cancer treatment, research on everything that's non-COVID. That has to be continued, that has to restart. And I really have been telling people, Lynn, we have two priorities. One is to get our healthcare system 100% back online and prepared. So if there is a second wave of COVID, it can handle it and we don't have to stop all these things again. We can't do that. We can't in the fall stop elective surgery, stop cancer treatment. The other priority, Lynn, is getting schools back in session for the fall. Two different things. We can talk about that later, the second one later. But I think getting our healthcare system restarted is imperative, that every hospital be back fully online.
Can we do that and still be safe and protect people?
I think we can. I think our system, especially now that we know better how to treat COVID patients, now that we're putting firewalls in place between COVID and non-COVID patients, now that we're starting to catch up on the PPE race that we've been in, which has been a problem, I think we can. I think we need to do more. I think from a federal government standpoint, there needs to be more funding to help prepare us in case there is a second wave of COVID. But yes, I do think as a healthcare system, as physicians, as all our healthcare staff, we are able to ramp back up and do those things as long as we have the government support to do it.
I want to talk about schools because that was definitely something that a viewer asked about. Do you think schools will reopen in the fall? I know it's going to be a case-by-case basis,
Right.
but what does that look like? And is it possible? Because there's no way for people to go back to work unless there's a place for their children to go.
Right. And that's exactly it. Getting our kids go back to school, of course, is important for the academic purposes, but it's important for all the trickle down. It's for the parents who are working parents and needs a place for their children to go that is safe. And it's for the children who need to go for their meals. There's just so many reasons we need schools back in session. So there's been a lot of information lately. I know you and I we heard talking about like the Kawasaki-like syndrome that has made me more cautious and again, vigilant as a parent to say, okay, we do need our kids to be able to go back to school, but we need to be very smart about it and very deliberate about how they're going to go back. What is the timing? And so there have been some really interesting work that the CDC has done. I've worked with some of my other colleagues on, what does that look like going back? It means they probably may not be able to eat all in the cafeteria together. Kids are going to have to be in groups smaller than 20. They probably will have kind of shifts, like this group gets to use the playground this week, then they may disinfect it, and then the other group gets to use the playground next week. Things like that are going to happen in smaller groups. I don't know what it means for like organized sports, but I think letting the children go back from an academic standpoint and figuring out what does a new school look like, it's not going to look like it did a year ago. I mean, you have young kids, Lynn, like our kids. We have a 3-year-old. They don't understand personal distance. They rub their boogers all over each other. So it's going to be a challenge, but we have to kind of create that separation so that it's safe for our children to go back to school.
I think academically it's so important, but also socially. They're really struggling. They're having such a hard time that they don't see their friends. They don't understand it completely. For the children that are older and they do understand it, they're just frustrated. And even if you're in a classroom, as one person's chiming in here, one Drew too, thank you so much for chiming in. He's saying it's hard to social distance when you have a classroom of 25 kids. Are they going to have to hire more teachers for smaller classes?
Yeah, this is going to be a challenge because especially in schools that have the larger classes, how are they going to do it? I think we're thinking through that right now. I think it's important. Initially, we thought we needed to close down schools to protect the rest of the population and the more vulnerable elderly population. We're now learning we need to close, the schools. Also, it's important that we're protecting the children as well, because even though most children who get COVID will be totally fine, there is some small subset that can become, even if it's a very small subset, can become ill from it. And we need to make sure that we're protecting our kids. So yes, to that person's question, we're going to have to figure out some new structural changes so that there are smaller classes and some better way to keep kids separated.
To the thing that you were talking about, the Kawasaki-like disease that they have been seeing in some children. I've been reading a lot about it. I know you as a mom of little kids feel the same way. It's confusing because it seems like it's treatable. There's treatments for it, but it's still so unclear. What do you know about it?
Yeah, so Kawasaki syndrome, it's pretty rare, and we don't know the exact cause of it. We think that there seems to be some sort of trigger, and two most likely culprits. One is environmental trigger, like maybe some kind of toxin in the environment, or an infectious trigger. So you have some infection, COVID, your immune system reacts to that. It overreacts. We've seen this happen in adults, but in Kawasaki, it overreacts. And in Kawasaki specifically, it actually starts to attack the lining of your blood vessels. So we've seen it with other infections that Kawasaki can result from. And so again, most children in Kawasaki's, it's self-limited. They will get better after about 10 to 12 days. But you want to identify early. You want to start them on IVIG therapy, other therapies to help them, because again, a very small subset of them can have long-term consequences. But there's multiple other things where you get an infection and your immune system kind of overreacts. It can happen after strep throat too. Again, it means that we need to be more vigilant. We need to figure out what the connection is and which of our children are most susceptible. So again, we can best protect them.
You know, when you were talking about what symptoms to look for, just even with my little one, he's a year and a half. And the other day I look over and he had red eyes and he had a little bit of a runny nose. And immediately, of course, you think of the worst case scenario.
Yes,
he's fine.
scary.
Nothing's wrong. But how do you know when you see one symptom and none of the others? How do you know when you're supposed to go into the doctor and potentially expose them?
Right. So, and this, of course, that's scary. And your mind goes to the worst case scenario because as parents, it's what we do, right? Like that's like when the minute you become a parent, you get your PhD in worrying. So I think the number one thing is remember, if your child has a rash, there are so many other normal causes for them to have a rash than Kawasaki's. Okay, so let's remember, let's keep this in scale. The Lancet out of UK, just to quickly give you numbers, they said we have 4 times, the one hospital said we have 4 times as much Kawasaki's right now than we normally do. That's a big headline. What they didn't say is that we normally have 2, we have 8. So again, we have to keep this in absolute numbers. That doesn't mean we minimize it. It's still very small. So the symptoms of Kawasaki's, though, it's usually a fever of 5 days or more, of like 101.3 or higher. And then they have that rash. You mentioned they have the redness of the eyes, but they have dry peeling lips, what's called a strawberry tongue, big red peeling tongue. And then can have rashes on their palms of their hands and their feet, and their feet. It was a late night in the
She is a doctor.
Just forgive my grammar. On their feet and swollen lymph nodes. So usually you have a fever and then one other of those symptoms. But bottom line, Lynn, you're a mom, I'm a mom. The number one thing I learned as a doctor is if a mom or dad or any parent or guardian comes to me and says, I know my kid's not right now, that's the 6th vital sign to me. That matters. So if your gut tells you something's wrong, seek care.
Let's move on to a question that Tom has here. He says, I work at a car dealership in Boston. Some come in with masks, some don't. Some are mad if we don't wear masks. Some are mad if we do. Wish we had a set standard for all. Very divided thoughts. Should there be this set standard? Because actually, I know in Massachusetts, where my parents are, there's now a $1,000 fine if you're in a public place without a mask. I know.
Wow. I was just asked about this just a half hour ago because they said same thing in the grocery store. They go in and people are wearing masks and they wear it to here and their nose is not covered. I've thought about that, kind of creating, here's the common sense guide to what we need to be doing. And when it comes to wearing a mask, yes, wear a mask. I'm telling most people, a mask can help us reduce the spread of COVID. That can help us prevent having to go into lockdown again. So let's keep this in perspective. You're wearing a mask, which may reduce lockdown and like another economic shutdown. I think wearing a mask in public is a pretty small price for that. Yeah. So yes, wear a mask, please.
Yeah.
It's a small thing to do.
And cover your nose with the mask.
Cover your nose. Don't pull it down. Go put on your mask, go in and get your groceries for 45 minutes, get out, and then you can remove your mask. Wear your mask for a little bit of time.
Dr. Darria actually has some exciting news to share as well today. So in addition to being an ER doctor and medical expert and all of these different things, she is the author of Mom Hacks. She has been a huge sounding board for many women out there dealing with what we like to call crazy busy, which has not changed actually post-COVID. In some ways, I feel like we're more busy in the parenting, working, homeschooling, all of the different things that have now landed on so many people's plates. And your crazy busy TED Talk was actually just selected, right? Tell me about it.
Yes. So this is really exciting. So I gave a TED Talk, a TEDx talk in November, and it was about how to handle your stress, and triage your life and end the crazy busy. Taking some of the lessons that I've used as an emergency room doctor and extrapolating them to our lives. So I got an email from TED.com, the global TED last week, that they had selected my talk and they want to promote it globally to help everyone handle their stress better. So that goes live. It's supposed to be live right now. It's supposed to go live at 11 a.m. So
where can people see it if they want to check that out?
Yes. So it is, let me see, my computer's just gotten crazy busy apparently. I'm looking for the link. Either that or it has COVID, something.
My Instagram live has COVID.
Right? Seriously. So it's supposed to be go.ted.com
Okay.
/ Dr. Daria, I believe. Hold on. I don't think, sorry.
Don't worry about it.
But yeah, I believe it's go.ted.com. Yes, go.ted.com / Dr. Daria. And that's 2 R's in Daria.
And it's really
So,
advice on how to tackle these things that we're
yes.
faced with every single day to sort of like, what's the number one piece of advice when it comes to dealing with the crazy busy?
So you're exactly right. It is, as an ER doctor, I have to be able to look at those double doors and say that whatever comes in those doors, I can handle it. And we need to be able to say that in our own lives. So here's one. Sometimes they can be super mundane, as easy as, how can you, save, automate things? Like, how can you subscribe on Amazon to as many things as possible so that you're not spending any brain power wondering if you have toilet paper? Well, toilet paper is a bad example right now.
Some over here.
Right. Normally, any other time, I have anything that I have that is a staple that we use all the time. I just set it to subscribe. I don't even think about it. You don't have to worry about if you have detergent or soap or anything like that. So that's one, is what are those same decisions you're making every single week? They're taking brain power. How can you automate them? So that's one important thing. Super simple. It saves you time every week. But another one is when you start to feel overwhelmed, I want you to look at the list of everything you're expecting of yourself to get done this week. I want you to take one thing off. Just take it off. Let it go. This is a triaging your life part. I'm going to let that one go. And then of the remaining things on the list, I'm going to choose the one next thing I have to do. And I'm just going to do that. And I'm not going to think about the rest of the list. I'm just going to think of the one next thing.
And
how we survive.
Yeah. I mean, everybody needs that right now, as far as not putting pressure on yourself. I mean, I think that my son's supposed to be on his Zoom class. Yeah, he was supposed to be on his Zoom class about 5 minutes ago. But it's just some days we do it, some days we don't. And it's just kind of like, just take off what you can from your plate and give yourself grace. That's something that I hope people think a lot about. And if you want to see more of Dr. Daria, it's go.ted.com / Dr. Daria. Is that right?
Yes, / Dr. Daria.
2 R's in Daria. But Dr. Daria, I just want to thank you for coming on and sharing some of your wisdom here with our Instagram followers. And we are going to post this for everyone if you missed it. And I'm going to put it on my website, lynnsmithtv.com. And I hope you'll head over there. But for now, dear, I hope that you stay healthy and well. And thank you. It's so great to see your face.
It's so good to see you. Thank you for all you're doing, Lynn. We miss you.
I miss you
can't wait
too,
to see you,
dear. I'll see you soon. Take care.
Take care, honey. Bye-bye.
Bye.